I am going to now introduce Sam Wilson. Sam is the president of the Wisconsin State AARP, and we're really thrilled to have him join us today with Amber Mullet to talk about social isolation in older adults, something that has just really been in the headlines over the past 18 months with the ongoing pandemic, and something which we have seen has caused just some significant issues for older adults and people with disabilities who are having to isolate. And Sam, I will let you do introductions for Amber, and I understand one of your presenters was not able to be here today. She took a tumble, so I will let you take it away. Thank you so much.
Thanks, Jane. And you're right. We use that phrase, break a leg, before we do a performance, but one of our presenters literally broke her leg. So we'll try not to say that anymore for fear of what could happen. And I know Amber will be on her way. Jane, I believe I have the ability to share my screen. So I'm going to click on that button and get to my presentation as well. And see if we can't get to there. And I just want to double check with you, Jane, that things are showing up okay on the screen.
I can see your slides, your sound is good, and ready to roll. We have about 110 people on for this workshop. And again, and I'm sorry. And again, in the past, if you have questions, people feel free to post your question in the chat. It may help if there are several people posting, if you just put the word question first before you ask it. That way it'll stick out in the chat. We'll be able to spot it.
Excellent.
Thank you, Sam. Thank you.
Perfect, Jane. Thank you so much. Well, it's great to be here with everyone. As Jane said, my name is Sam Wilson. I'm the state director for AARP in Wisconsin. And as a little background on AARP and how we find ourselves talking about social isolation and loneliness, we're, of course, a member organization with just about 820,000 members in the state of Wisconsin and about 38 million members nationwide. And we certainly know all of the issues that our older adults in Wisconsin and around the country experience around elder abuse and exploitation. And I always learn something from Paul Greenwood whenever I hear him speak. I've heard Paul, I think this is my third or fourth time. And while much of the content remains the same, I love the nuances and recommendations that he makes every time I hear him speak. So it was a great precursor. I also see my partner in crime, Amber Mullet, has joined. So I'll have Amber introduce herself when she gets to her section, and we'll go through this really in three parts. One, we want to provide you a little background about social isolation and loneliness. You know, Paul talked a lot about multidisciplinary teams, which I think is a really fantastic way of addressing some of the elder abuse and exploitation issues that are happening in our communities. One of the things we really would like to see as part of that multidisciplinary approach is having people who are on the upstream impact of that work be included in those conversations. You know, what we would prefer to have is to identify people who are at risk before they become a victim, and we have larger acuity issues. And that's really where we're focused on with this work with the Wisconsin Coalition to End Social Isolation and Loneliness, is to address what in public health circles we might call the social determinants of health. We might rename the social determinants of abuse and exploitation, because we know that loneliness and isolation can contribute greatly to people being targeted as victims for many crimes, including by their own family members. So with that as a context for our presentation today, let me get started. And I do want to say that we're going to talk a little bit about the history and the science behind social isolation and loneliness, so we're all speaking and using the same terms. I will then talk a little bit about the national and some local efforts that we've seen, particularly over the last 18 months during the COVID pandemic, that have emerged as practices to help people be connected and engaged in their communities. And then I will have Amber, who will bring us home in the third section to talk about this new effort that has emerged in Wisconsin around a coalition of organizations who are all narrowly looking at ways that we can address social isolation and loneliness amongst older adults and individuals with disabilities. So I will continue. So what do we know about just humans in general? We as a species are social in nature, right? We have come together throughout, our time to, engage in hunting and gathering and raising of children and bringing together of families. And it's something that we as a species do quite naturally. And so when individuals find themselves in those non-cooperative settings, it often provides the precursor to some of the physical, mental, and emotional challenge that people feel as a result. And the idea that loneliness serves a purpose is really to say it serves a purpose really to remind a lot of us of how important it is that we stay connected and develop a social safety net around ourselves and around our family members that doesn't allow folks to fall into the cracks. We have examined social isolation and loneliness through a microscope over the last 18 months. But as many, if not all of you know, social isolation and loneliness were issues long before the COVID pandemic ever hit, and they're going to be issues long after the COVID pandemic subsides. The problem is, or perhaps the opportunity that exists, is many people over the last 18 months that have never found themselves feeling lonely or socially isolated have had that experience. So it's elevated what people normally would have said, well, that's a very small segment of the population, and I'm not even sure how serious it really is. It's elevated it in their own minds as saying, my gosh, this has just been a temporary scenario for me. I can't imagine the impacts it has on some people on a regular basis. So that's how we get to really seeing social isolation and loneliness as important issues for both older adults and individuals with disabilities specifically. We really need to figure out, though, how we distinguish between the two. So loneliness is a much more subjective phrase, right? That is, it's an impression or an interpretation of how someone is feeling. You can have, a chronic loneliness, which is, that is something that you feel day to day, something that if we were talking to mental health experts, they certainly would feel compelled to examine to make sure it wasn't devolving into depression, certainly, or suicidal tendencies. But it's something that's with the individual on a day-to-day basis, regardless of the situation, whether they're in a crowd, whether they're by themselves at home. But there are assessments to find out how lonely you do feel, and as part of that social network that you have. And it can be both emotional loneliness and social loneliness, meaning emotional is your own individual pullback from others, and it could be social, that in the circles that you find yourself at that time, you feel lonely based on the others that you are interacting with. So loneliness, to be sure, when we talk about these two issues, is the much more subjective term. Social isolation, on the other hand, is an objective assessment. That is something where you can actually measure it with widgets, right? It's how many individual social connections do you have in your life? How often are you interacting with others, whether they be family members or individuals who help you in your home or deliver meals or provide you transportation, or how often you visit the doctor's office? You get the picture. So that's the countable number of interactions that you're going to have on a daily basis for interacting with individuals. And they can occur together or separately, as the bullet says. So you can be socially isolated by measure, but not feel lonely, and vice versa. So You don't want to say, well, if you've got one, you've got the other. These can absolutely happen in a vacuum away from each other, as people experience their lives in different ways. So prior to the pandemic, we would say that for those that have done the research around social isolation and loneliness, that we have had an epidemic of sorts of loneliness. And it's really interesting. And we had Dr. Ellen Rozek from UW La Crosse, who did a lot of the background research gathering for the Wisconsin Coalition to End Loneliness and Social Isolation, to find out, like, how prevalent was it if it wasn't just as a result of the COVID pandemic. What are we talking about? And believe it or not, the research says that the prevalence ranges from 40 to 69% of the adult population in the United States. That's an incredible sense, albeit a subjective measurement, an incredible sense of loneliness amongst the adult population. Well, since we, and particularly at AARP, we're interested in older adults and individuals with disabilities, we're immediately suggesting that, well, that's got to be an older adult issue, right? It could be, somebody's a widower, somebody's taking care of a loved one and they're incapacitated or unable to join them in social engagement efforts, or family has moved away. I think astoundingly, 80% of the people under the age of 18 are reported being lonely sometimes. 80%. Now, I know we're all immediately starting to think about the impacts of social media and the changes in behaviors amongst young adults in our country and in our immediate families. And that may in fact have something to do with it. But I find that quite astounding that as high as that number is for older adults, you even have about double that by some research measures of people under the age of 18. So we're going to talk about it largely in terms of older adults and individuals with disabilities, but to be sure, you are probably also seeing this in a much younger cohort as well. Now, there is some conflicting data in the research. So you have, in some senses, that says the COVID pandemic has increased loneliness amongst certainly older adult populations and the population in general. Some people have suggested, well, at 40 to 69%, prior to the pandemic, it's probably the same. Regardless, the numbers that we're looking at now, and now that we're actually collecting data and seeing this as a critical issue, particularly as a determinant of people's vulnerability to abuse and neglect, and certainly financial exploitation and others, it's remarkable to see how high those rates really are. So what are some of the risk factors? Well, some of them that we've known all along, as I mentioned, are the same. Women tend to live longer, right? And so as a result, many times they outlive their spouse and find themselves later in life living in a sort of single environment, living alone. Some of the new, certainly, variables that we talked about in the previous slide are young adults and low-income individuals who are feeling themselves a little bit more disconnected than in the past. So what are the contributing factors? Well, I mentioned social media before. That certainly is no surprise that people are more engaged in their virtual and online life than their previously in-person social life, and that can be a contributor to loneliness. Reduced volunteerism. Wisconsin, I believe, for a long time has been one of the top states for volunteerism amongst our population per capita, but overall, as a nation, we're seeing a decline in volunteerism in our communities. Lower religious participation. This also goes hand in hand, and while that's true, it's lower participation in not just religious organizations. You see community service organizations, your Elks clubs, your Lions clubs, your Cosmopolitan clubs, all of that see declining participation, which are, again, are those, natural connections that people in the past have made, and a social safety net that is created around those organizations. So that participation alone in any of those organizations is a contributing factor. You'll also have family structures that are changing, many fewer multi-generational households, many families who are no longer living within, let's say, a 5-mile distance from each other. We're a much more mobile society, not just literally mobile in our communications, but mobile in our ability to pick and choose where we want to live and with whom and near whom we want to live. So some of those family structures have changed. We're living longer. I talked about widowers, and that certainly is a contributing factor, right? We're living longer, which means that even if someone was to lose a spouse, they're more apt to live much longer beyond the spouse's lifespan, not just a year or two, as we may have expected 3 or 4 decades ago. So that certainly has a bit to do with it. Divorce rates certainly have been a contributing factor for many years. And then, of course, living alone as a factor as well. This one, to me, is really amazing. So prior to 1900, 5% of households in the United States was a single individual, 5%. In 1950, it was 9%. So you're doubling over 50 years, but still a relatively small number. So if there was a guess, Amber, what's your guess on the percentage of households in the US that have one member today?
If it was doubling like that, I would say 15. Give us a little bit more time, 15%, 20%?
So today, 30% of households have a single member. So one person living in the house. That's pretty amazing. About 35 million people living in single person households. So all of these factors contributing to this, what we're seeing around research around social isolation and loneliness. Certainly social isolation, just by the fact that we have many more individual households, and then how that contributes to individual loneliness. So what does loneliness bring? So what are some of the the downstream effects from both loneliness and social isolation? Well, certainly higher morbidity and mortality amongst loneliness. Some of these probably won't be a surprise to folks. Higher cardiovascular risk, more depressive symptoms, more cognitive decline, something that we talk a lot about in older adult populations, particularly the older you get in the older adult population. And then for social isolation, the downstream impacts are, increased health risks, and you see those listed below. Many of those have been the same downstream effects for some time for both of these instances.
Sam, I think it's interesting, just to go back, I appreciate that you calling out the smoking. I have seen stats that show that just the experiences or feelings of loneliness is the equivalent of smoking 15 cigarettes a day, even if you're a non-smoker. And we know that all the research and data is proving that. So even for those who do, or it's exacerbated, I think that just really goes to show the impacts on our overall physical well-being as well. So thank you for calling that out. That's
well said, Amber. And we have this saying, as we've talked amongst coalition members, that it was sitting was the new smoking, and now isolation is the new sitting. So, all of these things have sort of that same negative impact on almost an equal level to people's overall health. So thank you for listing that. And then, of course, knowing who we have on this webinar today, we know all of you have acute interest and experience in what the downstream impacts are for people who are social isolated and at risk, particularly around financial exploitation and physical abuse and the like. But these, I tried to pull some headlines just from, this is just from 2021, this year, as people start to examine the impacts of 12 to 18 months of, COVID isolation amongst older adults. And you'll see protecting seniors from fraud and abuse during COVID, romance scams on the rise during the pandemic, being isolated can put older adults at risk for investment fraud and other scenarios. So yes, when we talked about at the very beginning, social isolation and loneliness has been an issue before the pandemic, but what's given us the opportunity, that the pandemic has given us the opportunity, I guess, I hate to say it's not a silver lining, but an opportunity, let's say, is some of these issues that were prevalent before have now been experienced by more individuals, and it's allowing a lot more conversation to figure out how do we address these in our communities and who we need to bring together. Amber, any last thoughts about that history or research section before we move on?
No, I just want to call out that last slide and the importance of identifying those downstream impacts of feeling lonely, feeling as if you need to have folks in your life. So it's forcing our older adults, folks with disabilities and others to make a hard distinction. I know I'm being exploited against, and I'm no longer feeling isolated because there's somebody here, right? So we're asking folks to choose, and we're asking folks to say, well, but I'm getting my social needs met, even if there's a cost to that. So I think it's a really important opportunity, as you said, to raise awareness and to start addressing those downstream drivers and acknowledge with empathy where folks are at. We're asking folks to choose. Both are not good. I feel lonely. I don't have a whole lot of social opportunities or engagement. So what little I do have must be worth it, even if we know that there's other negative consequences that go with it. So it's just a complex situation. So I appreciate you giving us all that background.
Yeah, no, thank you for that. So now we're going to jump into basically section 2 of our presentation, which is, okay, you've told us what the problem is, Sam. Now what are we doing about it? Because that's getting to solutions is an important step. So we want to call out the local, state, and national efforts that are underway. And I'll certainly start with the national and the local. So one of the areas that one of the benefits, again, of calling out how much this has impacted older adults over the last 12 to 18 months is the Administration for Community Living, which is, under the Department of Health and Human Services in Washington, D.C., so national government agency, has identified social isolation and loneliness as one of their priorities and has made it a goal to reach up to 10 million older adults and individuals with disabilities to make sure that they have the resources, the information, the guidance they need to prevent social isolation and loneliness in their own lives. A great first step, because often what the Administration for Community Living does is it sets prioritization for state agencies and local agencies to make these their same priorities in the work that they do at a more local level. The interesting thing about the efforts with ACL, and that's a commonly used acronym that we would use in our world to stand for the Administration for Community Living, is they've created a public-private partnership in order to create a clearinghouse where people can get information on these particular topics. Now, many of you that have a background or experience in these issues probably have your favorite assessment tool or your favorite go-to website that you gather information and resources from in order to share in your networks. That's absolutely true. There has never been a national clearinghouse where many of those best practices are kept. The idea is that this public-private partnership gives us the opportunity to have one central agency and one private organization working together to make sure there's a true one-stop shop where people can go and get information on these particular issues. So I'm going to use two phrases too, which is going to be a little dicey. So have pen and paper in hand. There's commit to connect and there's connect to effect. So commit to connect is the ACL's prioritization and their effort to create more awareness around social isolation and loneliness. Connect to effect is going to be what's been created, and we'll talk about that shortly. But what ACL wanted to create was this online consumer-focused tool, a clearinghouse of sorts that has all of this information. It has assessments, it has how to find services in your community, it's how do you connect with technologies that address isolation in the home if you need remote monitoring or weekly check-in calls or whatever it may be. Here's the spot where you, a family member, an agency, a community organization can go to get that information. The other great thing is that while there is very little evidence-based, I would use the term tactics for addressing social isolation and loneliness, there are evidence-informed tactics, sort of best practices for lack of a better phrase. The scientific advisory group for this effort is really charged with finding those best practices and making sure that those are readily available as well, because we know we don't want to first reinvent the wheel. If there's something going on that's really effective, we certainly want to duplicate that, but we also want to weed out any efforts that have been tried and have tried to be innovative, but are just not all that effective. So the scientific advisory group will help with that. And again, the network of champions, which I think is a really great effort. You can sign up to be a part of the network of champions. You get information emailed to you and invited to special events where people can share their local experiences with addressing social isolation and loneliness in what is deemed to be just one large information gathering and sharing effort and network. So a lot of new and really interesting approaches to these issues. If you wanted to go find out what ACL is doing, here's the website to go to. This is where you're going to get the 30,000-foot view of how the federal government is focusing on older adults and individuals with disabilities around the issues of social isolation and loneliness. Now, connect to effect, which I said was the other phrase you needed to keep in mind, is the actual platform where you can go to find those tools and resources that we talked about. AARP Foundation is the organization that is partnering with ACL to ensure that those resources are easily accessible, free to everyone. There's not a charge to anyone. So whether you're an individual or an agency looking for information, you can go here, search, do assessments, find services, whatever it is you need. At connecttoeffect.org, and you'll see the goals below. They're the same, they're aligned with ACL, but really this is the platform that we're directing everyone to if you're needing to find information and maybe some best practices for your own communities. This is the website. I just like to show a picture of it. So if you were to get to connecttoeffect.org, this is what you would find. Obviously, there's a looking for, there's resources, there's finding help in your area, and then there's the assessment, which I think is really interesting. And the assessment you can take for yourself if you feel that you may be at risk. You can also take it for a family member, because at the end of the assessment, it will actually say, are you looking for services in your area? Are you looking for services in a family member or loved one's area? And it really tailors the advice and guidance that it gives to you based on the responses of the assessment and the geography in which you're looking for additional information. So really easy to navigate platform, really easy to navigate website, again, at connecttoeffect.org. The other really interesting thing is we've had several senior centers and local organizations who have said, you know what, we want to do something more than just hang a flyer on the wall asking if people need assistance. And we don't have the ability to develop our own curriculum to guide people through a discussion about how they identify themselves or others who may be at risk for social isolation or loneliness. What's available? Well, the best part is one of the things that Connect to Effect has done, and it's available on connecttoeffect.org, is community workshops. So it has all the tools you would need to lead a discussion of older adults, individuals with disabilities, family members who may be concerned about loved ones who may be isolated, to have a conversation about how do we look out and how do we head off these issues that may be happening in someone's life. And there's some really great tools about how to assess your social network, how to build your social network, and how to find organizations and others in the community to connect with. So just some really fantastic resources. Whenever I do these presentations, I want to leave you with some action steps that you can take. And so certainly this is one area where you can find more resources. We also, about a year into the pandemic, and we were just starting the coalition, said, we know there's things going on in our communities. We know there are local efforts. It's not, people are not just saying, wringing their hands of the issue. So we sent an email out to the organizations that said they were interested in participating in the coalition and said, what are some of the best things that you're either doing or seeing in your community to keep people connected during the pandemic? Mostly because we wanted to see what was going on during the pandemic, but also to find practices that we can then highlight post-pandemic as replicable, either because it's, you're in a rural county, your resources are unlimited. I'm in a rural county, my resources are limited. You were successful. Well, I want to replicate that. Same for urban and suburban areas. So we really wanted to find, regardless of size of community, geography, region, whatever may be the case, things that could be easily, as I have said, replicated from county to county or city, town, village, whatever may be the case. So here we assembled some of the different programs. It can be something as simple as weekly exercises and puzzles distributed at meal sites. It's making phone calls to individuals that they identified in their community who are widowers. It's addressing people who have early on stage Alzheimer's and their caregivers to connect with others who are experiencing the same journey so that they're not in their homes, isolated from others, and they can share those frustrations and joys that they're experiencing. In Madison, they did a pen pal program through their senior center and connected with other older adults in the community just to make new friends and say, hey, how are things going? They had computer tablets for people who didn't have access to technology early on during the pandemic. So people were able to connect either with family members or just to find out more information about things like, getting vaccines or how to stay safe during a pandemic. So a lot of great information was shared there as well. The ADRC of Brown County also, shared a lot was with, there was a lot going on with technology. And I know all of you and your organizations experienced this dramatic shift from in-person events and connections to virtual connections. And you'll see in many, if not all of these instances, the ability for organizations to act very quickly to figure out ways to utilize technology to substitute or supplant some of these social isolation and loneliness efforts that were already underway and may not even been called that, but we now see them for what they are. They were efforts to build connections with people. And notwithstanding Mike Austin's previous inability to unmute himself, we all have learned Zoom, right? We've learned Zoom, we've learned Teams and WebExes and everything else, and many of these again have been adapted for connecting people together. And you can do things that are even much simpler than that. Not everything has to be technology based, and not everything has to be complex. You see the Shorewood Connects program, they're doing, we're just around the corner from rake and leaves, unfortunately, but fall yard cleanups and delivering grab and go lunches where people can literally drive through the parking lot and grab lunch, and you're putting resources and information into the lunch bagger box, and then getting out and volunteering for people that don't have loved ones or friends or family in the area. So just really remarkable examples of how really people rose to the occasion and organizations rose to the occasion during the pandemic. But again, I will just reiterate, these are also practices that can be done regardless of the situation that we find ourselves in from a public health perspective. So that's some of the national and local efforts that we've identified at the Wisconsin Coalition to End Social Isolation and Loneliness that we see as particularly effective. And I now would love to cede the floor to Amber to talk more about specifically what we're doing in the state.
Awesome. Thanks so much, Sam. And so great to be here. Thank you all for hosting. This is a really important topic, as well as acknowledging that this is nothing new. This is just something we have the opportunity to discuss and the opportunity to start addressing. So my name is Amber Mullet. I work at the Department of Health Services. I'm part of the Bureau of Aging and Disability Resources, where I have the wonderful opportunity to support our disability-related programs. So I work with folks who are deaf and hard of hearing, blind, visually impaired, folks with physical disabilities. I work with the independent living centers throughout the state. And amazingly enough, I have the unique privilege of working with 6 either governor or secretarially appointed councils. And it's interesting to note how the trends have shifted either prior to and during the pandemic response. So in the spaces which I find myself working primarily, we've been talking about isolation and loneliness for quite some time. This is an issue that is near and dear to the disability community, and something that we've been working towards addressing in terms of inclusive design strategies, walkable communities, green spaces and parks. But we have a unique opportunity as a result of the pandemic, and as a result of conversations happening in a variety of spaces, to really capture the momentum and do something with it. So we have established the Wisconsin Coalition to End Social Isolation and Loneliness. The beautiful space about this coalition is that no one owns it. We're all members. We're all part of it. It's a collective impact approach where we say we have this complex, wicked systemic issue problem, and we all have a role to play. So we've started by bringing together folks with our aging community and folks with disabilities and nonprofits. So this beautiful hybrid of public-private partnership saying, yes, we're committed. What is it that we do with it? Because we know that if we don't take this moment in time to address the knock-on effects of the pandemic, to address what we've seen, to address what data is telling us, and what data is warning us. As Sam mentioned earlier, we're seeing that 80% of people under the age of 18 report feeling lonely. Those individuals are growing up. That's our next generation or 2 or 3 of older adults and folks with disabilities. So how do we really set the programs up? And how do we set the stage to say, this should be the last time folks feel lonely in the community? How do we move that? And this is what we do. We've engaged a collective impact process. And for those of you who have not been in a formal collective impact work group, you've probably done a lot of these strategies already. All of us here have a common agenda, right? So even though you may not be a member of this coalition, we're working to support older adults in the community. We're working to address the knock-on downstream drivers of their health. We want what is best for our community, and we want to live and grow and prosper and be engaged just like everybody else. So we're all working towards that, whether or not we can say we're a member or not. We have a shared measurement system. So we have an amazing group of researchers, and I'll talk about their work group soon, of what is it that we're actually trying to do. We want individuals to experience less feelings of loneliness that impact their health but also acknowledge that not everyone wants to be socially connected all of the time, right? So when we think about social isolation, it's not always a bad thing unless it contributes to those feelings of loneliness. So that's why we're managing both. We're not saying it's all good and we're not saying it's all bad. It's really unique to you and how you as the individual tend to intersect with the world. So let's look at the measures. When we see something that is causing negative health outcomes, then we want to turn the dial so that it's moving towards positive outcomes so people have those opportunities. We also want to make sure that we're really holding space for the community by reinforcing our activities in a mutually supportive way. What's good for the state of Wisconsin is good for AARP, which is good for DOJ, which is good for the APS system, which is good for my friends and family that live in rural Wisconsin. So how are we coordinating our activities so we move into a win-win-win? This is not a space of, government compliance. This is a space of let's lift ourselves up. And what does that look like? So we're able to pull from the strengths of everyone engaged. So this is really an asset-based or strength-based opportunity where everyone has a role and an offer. The other space that has been unique and kind of fun to explore as we're navigating this new hybrid workspace, this technological Zoom world, is continuous communication. So how are we communicating not only with ourselves as a team, with our partners and with the communications at the local level? So email messages, webinars, talking points, one-pagers, posters, you name it, so that we all have the same language and we're all moving together collectively. And then this is the unique role that the state of Wisconsin is playing right now. So each time we do a collective impact approach, we have what's called a backbone support organization where we provide project management. We provide like a mutual meeting space, which is usually a Zoom meeting room, but we're also able to say, let us move this forward so that we're all kind of cruise directing in the same way. And that's the role that the Department of Health Services is playing right now in order to move that. So we have a variety of work groups that have been set up because we know this is a complex issue. And we know that in each complex issue, there's a variety of perspectives and facets. And to move this needle forward, we all have to be working together. So we have our public awareness work group. So this space raises the awareness of loneliness as a public health issue. So most of the time when we've talked about loneliness, we really pull on the empathy. Like, we don't want anyone to feel sad. We don't want folks to feel lonely. And we don't want folks to have a 50% chance increased risk of developing a dementia. We also don't want folks to have a risk of cardiac arrest. We also don't want folks to increase their risk of stroke by 32%. So as we're sharing this is more than just, pulling on empathy, saying, I don't want anyone to feel sad or lonely. It's, I don't want individuals to die early as a result of these feelings of loneliness, the physical attributions of their health. We want everyone to live well and prosper and thrive. So what we're doing is we're taking that awareness to say, this is an issue that we all care about, and this is an issue we can all address. And how we do it is by pulling the resources and sharing that information. So we know that this is what data is telling us. We know that individuals are experiencing isolation and loneliness at this level right now. We know it's having an impact on their physical health. We know it's having an impact on their mental health and their emotional well-being. So what do we do with it? It's one thing to talk about it, but it's another thing to look at evidence-based practices, which is where this research and sharing group is really coming into, because what we want to say is, here's what we found. Go forth and do this and make it, customized to your community or to your population, so that we can all be engaging in that same kind of common agenda, moving the needle in the right direction. We also want to make sure that as we're all collectively moving, we're engaging in this work, we're supporting the communities, we're using data to drive the point home with our local organizations, our boards, our communities, our nonprofits, our Lions clubs, our elk clubs, our senior centers, our aging and disability resource centers. What we want to say is, how do we make sure that it fits all communities? We really want to lead with equity as the aim. We want these interventions to be customizable for a variety of communities. What's working well in Madison, in Verona, where I reside right now, may not work with my friends and my family in Augusta, in Eau Claire County, because there's different assets to pull from. And what may work for us in this area may not work for individuals with disabilities or the Hmong community in Brown County. So how do we make sure that things are customizable and meaningful? We also seek to advocate for public policy. So we are all interconnected by a system, and we know that the environment around us plays a role in our overall health and well-being. So if we're going to address loneliness and we're going to address isolation and social isolation, we know that that means we have to address our environment. What systems are keeping us isolated? What systems are contributing to our feelings of loneliness? The fact that we're seeing young adults report loneliness at 80%, even though they're hypo-connected and socially engaged in social media and other platforms and they're out and about, that tells us something about the environment. So we have advocates who are seeking to address those policy solutions that will help us even combat this even more. So we have developed a few strategies that we're starting with. So, and we're going to ask you to help us. So we're all part of this call. We're all part of addressing the issue. And what we want to do is make sure that as we're talking about the public health impacts and we're talking about loneliness, that we're really avoid pointing fingers at somebody. Well, if you just did this, or you feel lonely, or you should engage more, or you should talk to that person, or you should advocate. Remember, it's a systemic issue. This is something we're all experiencing and we're all facing. So let's not put that message onto a person, and let's not imply that if you just worked harder, you wouldn't feel that way. We know that's not true. We also want to make sure that we're addressing those root causes. So it isn't, though, it's just a result of the pandemic. There's so much more behind those feelings. So as we're moving to generating awareness, we're talking about things such as transportation, feelings of belonging, family engagement, cultural considerations, abilities to celebrate, things such as that. And what we want to do is to create action steps and opportunities, whether it be virtual, whether it be in person, but we want to make sure that those connection opportunities are meaningful. They are social in nature. We as human beings are designed to connect. We're designed to be in constant communication with others. We're designed to have a purposeful meaning behind what it is that we're doing. We want to feel good about what we're doing. Everyone has this strong desire to have a purpose, and we want to be able to help others with that because it fuels our own mental well-being. So we've started developing several one-pagers and sharing this with others. So this is an opportunity and a call to action. If you yourself are noticing that you're feeling disconnected, well, let's get off the screen. Let's put our smartphones down and let's plug back into the community. Sam mentioned earlier that we're noticing lower trends of participation, lower trends of civic engagement, lower volunteerism, but we also know that those opportunities are what fuel us and help us feel less lonely. So it's a really easy opportunity for us to say, I'm seeing where I'm at, and I'm noticing that here's a call to action, here's a purpose, this is going to serve me really well. I'm going to get engaged, even if it's something really small. We don't have to then apply to be on a board. We don't have to apply to be the leader in this space. What we have to do is just plug back in. It's going to help us, it's going to support the community, and we're going to pay the way forward, right? So we're constantly paying it forward by getting engaged and going back to what brings us joy, going back to how humans are designed to connect and interact, helping our communities, helping our neighbors, supporting each other. And we've seen those messages throughout the pandemic. And now more than ever, we want to make sure that as we're moving forward, it's got to be a win-win, right? Like what are our priorities for ourselves? What makes me feel really good, right? So doing what makes me feel good typically is what the community needed to feel good either. So if we're finding ourselves trying to figure out what is our purpose, what can we do? I'm feeling this way. Start with you. What's your signature strength? What's your asset? What's your superpower? And how do you give that back to the community? So we tell people, do what fills your bucket. One of the quotes that my team and everyone else kind of has started like replicating from me is, you do you. Whatever is your superpower, what makes you happy, start giving back in that way. And then just notice the physiological changes that are happening, noticing that there's others kind of following you. All of a sudden you see that you have more interactions and more connections. And even if it means a longer chat message with a friend, start there. And I'm going to invite you to join us, right? So this is an opportunity for all of you to participate in our coalition, because it is going to take each and every one of us focusing on our small sphere of influence, doing something different. You can become as active as you would like. You can hold space for it. You can share opinions. You can provide feedback. You can just get information or resources as we start sharing it, because that's how we're growing it. I'd love to tell you what our 5-year strategic plan is or what we're going to do to move this out, but it's iterative. It's generative, and we're co-opting building it. So what I'm going to do is put a link to our survey and invite you to kind of join our collective impact approach, support the overall health and well-being of folks in Wisconsin by supporting the coalition to end social isolation and loneliness. Sam, is there anything that you would add specifically about some of the work groups, the ways in which we're engaging?
I think you laid it out really well, Amber. I mean, I think the best part is that the coalition is now really 9 months, 8 or 9 months in existence. And so we're at the stage of building capacity to address these issues. And I think the thing that people can be assured of is that we really have a long-term focus. There isn't a short goal that we're trying to achieve or something we're trying to solve. This is really about us creating connections, as you've talked about, Amber. So I know it's really important as the coalition has built momentum, and we've had a lot of hand raisers. I think when we did our first email out, Amber, there was, I may be wrong, but it was in excess of 100 organizations and individuals raised their hands and said, how do we get involved in this coalition? Here's what I can contribute. Here's how I'm connected in the community. And so every time somebody raises their hand, we try to find their strength and plug them in with one of those work groups, as you mentioned. So the more people we can get to, again, raise their hand, the more we can engage you and bring you into the fold for the work that we're doing.
Absolutely. And you'll see social isolation, you'll see loneliness, but you're also going to start seeing social cohesion, connection, feelings of belonging. So we're also moving into an asset-based approach. And that's one thing I really appreciate about our coalition is it's always moving us to a yes and, right? You have a strength and this is how you carry it forward. Yes and. So yes, we know that there's a deficit and we're trying to address a problem, but we can do so by focusing on community and individual strengths and opportunities to engage.
And Jane, I think with that, I know Amber has put the engagement survey in the chat, so people can click on that now or in the future and let us know what they're thinking about their involvement with the coalition. And if there are any questions, I haven't really been observing the chat very closely. So if there are, we're happy to answer them. If not, we'll take your guidance.
Yeah, there weren't any questions, but thank you so much, both of you. This was just wonderful information, and I encourage everyone to complete the survey. It's not very long, I'll tell you. I don't even think it's 15 questions. So please consider doing that. And we have a few minutes left. So if anyone has a question, post it in the chat, or if you're feeling so inclined, let us know in the chat, what are you doing, or what are some things you're seeing locally for how people are addressing social isolation in your community? would love to hear some ideas or hear about what maybe you're seeing in your community or maybe even within your own family. What are you doing to avoid that sense of isolation? What makes you happy? The weekend's coming up. What plans do you have to get out, enjoy the fall weather? For me, I'm making a road trip. I have to babysit the grandkids, so chance to see them. Yes, I get to go to one house, but not the other because we've actually got the 5th grader quarantine at his house. So it's school. So let us know how you're doing with social isolation. It has affected so many the past 18 months or so. So I have a question, Amber. Do you anticipate then the coalition continuing? Is there will this be something that's ongoing, or it's going to just initiate some work on the survey and then kind of allow or not allow, encourage a continuation more at the local level as people get engaged? Or what is your hope for that?
Thanks, Jane. So my hope is that we move into and stay in the space of both and. So there's a role for large organizations and private organizations like AARP to say, here's what we're doing nationally, and here's how we can help our members, and here's what you can do. And there's a role for the state of Wisconsin to say, you know what, we have a public health issue that's impacting individuals' longevity, it's impacting our health, so we're going to do something about it, we're going to get ourselves organized. But we know that the real power of change happens at the local community level. It happens with the contacts that I'm aware of. It happens on myself and by reaching out to folks. So the idea of this coalition is to really build the capacity so that we have a variety of work groups and spaces and individuals addressing this and what makes sense to them. In addition, what we're trying to do is identify and bring up these issues and land it in our state health plan. So the state of Wisconsin has several health priorities, and we're aware we've been focusing on 5 of them for the past years. We've been focusing on alcohol, tobacco, suicide, the opioid epidemic, and physical health and nutrition. But during our last needs assessment, our last state health assessment, social cohesion, belonging, loneliness, and isolation came up in every single community that we talked to. So we would not be doing due diligence to the state of Wisconsin if we didn't raise this up to say this is a health issue that requires quick, immediate, and cohesive response and action. But the beauty of this is we're going to come up with some research, some trends, some ideas, some opportunities, but really you do you. What does it look like in your community? So, and that's the space we're trying to identify. We know that as the state of Wisconsin, we have a role to play, but we're not going to play all of the roles. So we really want to focus on lifting communities up and identifying what is everybody doing. I mean, Sam gave us a beautiful list of what's happening on the national level, beautiful examples at the local level. And we want to underscore that at the state. So we'll see what comes up. I think we'll always have a role to play, but how strong or how engaged really depends on how much the communities are able to do this and how we're able to move forward in partnership. Does that answer your question, Jane?
Yeah, thank you so much. I really appreciate that. I was curious as to whether this would be something that would just continue on, and hopefully it will, and especially at the local level, seeing a lot of good things happen in some of the counties, and know that people are trying to build on that and reach out to people.
To be honest, I would love if we actually addressed this, right? So my goal is always to work myself out of a job. If I don't need to hold space for inclusion and folks with disabilities, then I did my job. If we're seeing the trends in the data say individuals are completely engaged, they're belonging in their community, we're seeing the health decline, like impacts decline because people are engaged and we don't need to have a coalition, then I'll say we won, and we'll identify what that next space is. So until we can get to that point and work ourselves out of an issue or a problem, we're going to continue to hold space for this really critical venture.
Yeah, the statistics are really somewhat alarming when you read some of the research around life expectancy now being what it was after maybe World War II, that we've lost a year or two. So very concerning. We know social isolation has a significant impact on people in so many ways, and encourage people to do what they can locally to ensure that individuals in their community are not struggling with being alone. There's just so much that can be done. So, and someone did post, they're looking again for what's the site again for the posters?
The posters are sent out on behalf of our coalition. So feel free to send a survey and you all will get links. Even if you're not going to engage, just say you want information. So we send information out, so you'll get access to the one-pagers, the posters. Hopefully you'll start seeing those, tweak them and make them your own. In addition to that, we send out information about what's happening on the national level, webinars, TED Talks, even just to fill your own repertoire of resources. So we do have those who'd like to be the armchair participants, because that's still a participant in this movement.
Sure. All right. Thank you both so much. I really appreciate you being able to be here. And I know that Jan Zander was really sorry that she had a little accident at home and unfortunately was not able to be here. So thank you so much. We really appreciate your time and all of the information that you provided today, and reminding those of you that joined us today that the workshops have been recorded and the information and other resources will be shared at another date. So thank you again. Really appreciate it very much. Thank you.